sir, we are live now.
Good evening all. A warm welcome to For the Students, by the Students web series organized by ExRxIndia in association with the Sandra Health Services Private Limited, People Studio, Dusa Creations, Sairam Academy, powered by Fitness and Rehab India YouTube channel. ExRx India's 136th topic is actually forgot to ask the topic, please.
Frozen
Hello,
shoulder.
sir.
It's
Frozen
not
shoulder.
fried. Frozen shoulder.
It's frozen
Presented by
shoulder, sir.
Ms. Sandra Sanakan from KMCT College of Allied Health Sciences, Calicut, Kerala. Now I welcome ExRx India team members, Dr. Rupesh and Professor Duna Saha. And now I welcome our resource person, Ms. Sandra Sanakan, to present a topic on frozen shoulder. Please.
Okay, sir. First of all, I would like to thank Sandra Mohan, sir, Rubesh, sir, and Juna for giving me this opportunity. And also our sir, Vijay Selvan, sir, and Srisha ma'am, and Vibin sir, Safa ma'am, and all other faculties for helping me in this venture. Without making any delay, I am coming to my topic, frozen shoulder. Also known as capsulitis, is a condition characterized by stiffness and pain in your shoulder. It is defined as a glenohumeral joint with stiffness that cannot be accepted on the basis of joint congruity, and it is more commonly seen in women than in men. Next, we shall move to the muscles of shoulder joint. The main actions of shoulder are flexion, extension, abduction, adduction, lateral or external rotation, and medial or internal rotation. The muscles help for the flexion is anterior fibers of delta, extension of adduction pectoralis major latissimus dorsi, lateral or external rotation infraspinatus teres minor, and medial or internal rotation subspinatus. Then we move for the types, primary and secondary. In primary frozen shoulder, no intincting event but extrinsic and predisposing factors are present. Intrinsic factors like age between 40 and 60, female sex, diabetes mellitus, extrinsic factors like immobilization, fault body mechanics, etc. Then secondary frozen shoulder. For that, rotator cuff disease, fracture residuals, calcific tendonitis, previous shoulder surgery, osteoarthritis, cervical spine lesions, autoimmune disease, chest wall tumor, etc. Then stages of frozen shoulder. We have 3 stages: freezing stage, frozen stage, and thawing stage. First, we shall discuss about the freezing stage. In freezing stage, the pain during movement slowly get worse over time. It hurts most at night, and it lasts up to 6 to 9 months. Then we go for the second stage, that is frozen stage. In this stage, pain gets better, but stiffness gets worse. Movement became difficult and it lasts up to 4 to 12 months. And the final stage is thawing stage. This range of motion starts to normal and it can take to 6 months to 2 years. Then we are coming to the pathology of frozen shoulder. chronic inflammation, perivascular infiltration, myofibroblastic proliferation, subacromiositis. It's very rare. And autoimmune causes, trigger point with myofascial pain syndrome, local periarticular hypoxia, and so on. Incident age 40 to 70. Hello?
Your slide disappeared.
Oh, sorry, ma'am. Can I share it once
Please
more?
reshare your screen. Yeah.
Now is it
Go to
visible,
the
ma'am?
slide. Yeah. Please continue.
Okay, ma'am. Okay, ma'am. Sorry for the interruption, ma'am.
It's okay. Please continue.
We are incidents, age 40 to 70 years. Then there's a chance of occurrence in 2 to 5% in non-diabetics and 10 to 20% in diabetics. More common in females. Then we go for the test. The main tests are Nice test, Hawkins-Kennedy test, Dropam test, SLAP test or O'Brien test, empty can test, and Apley scratch test. Test. We can discuss the Nice test means place the hand on the patient's scapula, other on the forearm. Then patient fully internally rotates, thumb pointed downwards, then passively forward the flex arm through the full range of motion. It is also known as impingement, that is means pain. The next is Hawkins-Kennedy impingement test. Here, patients stand while the examiner forward flex the arm to 90 degree and forcibly medially rotates the shoulder. This moment pushes supraspinatus tendon against the anterior surface of the coracoacromial ligament and coracoid process. Pain indicates when there is a pain occur, it indicates a positive test. Then drop arm test or rotator cuff tear. That is, it is abducted, arm slowly lowered, may be able to lower.
Sandra, you there?
I think disconnected. She started sharing the screen.
She's sharing again.
Yeah. It's okay. Kindly adjust with that.
Yeah, of course. No problem. Sandra, you can continue. Please unmute your mic.
Hello, ma'am.
Yeah, share your screen once more.
Yeah, ma'am. Is it visible, ma'am, now?
Yeah, please rotate horizontal.
Can I continue?
Yeah, please continue.
Okay, we are dealing with the drop arm test. Abducted arm slowly and lowered, may be able to lower arm slowly to 90 degree, that is deltoid function. Arm will then drop to side if rotator cuff tear. If the test is positive, patient unable to lower arm for the control. If able to hold at 90 degree, pressure on the wrist will cause arm to fall. Then the test is empty can test. In this test, we can do by 90 degrees of shoulder flexion, internal rotation, and 30 degree of horizontal abduction. Then downward pressure is applied and weakness and pain are assessed bilaterally. These are the tests for frozen shoulder. Go for the treatment, counseling, medication, physical therapy, and surgery. In case of surgery, we go for mainly arthroscopic surgery. There are other surgeries, but when conservative treatment fail, only we go for the surgery. Then counseling, medication, and physical therapy. In case of medications, anti-inflammatory drugs are given, steroid injections are given, and NSAIDs. And expression and addiction. Then we go for the do's and don'ts for the shoulder. Shoulder frozen shoulder to a patient. Just do your physical therapy exercise regularly. Do use an pack for 10 minutes, 3 to 4 a day. Do take pain medications as recommended by your doctor. Then, when frozen shoulder occurs, please don't let the pain to stop you from moving. Don't involve in jarring or jerky movements. That means don't make a hard movements for your shoulder. Don't sleep on the frozen shoulder. It will make you pain more. Then don't skip your physical therapy sessions. Then don't neglect or diet, as frozen shoulder is sometimes associated with overall state of health. Then go for the modalities used for frozen shoulder. In physiotherapy, we use ultrasound in a pulsed mode for 5 to 10 minutes. Then low level laser as per week for 8 consecutive weeks. The duration is 180 seconds. Then the interferential current, transcutaneous electrical nerve stimulation, and pulsed electromagnetic field. As we all know, the frozen shoulder are common in diabetic patients. It is because of collagen in the shoulder, which holds the bone together in a joint. This is the common reason as diabetic patient, the incidence of occurrence of frozen shoulder is more, that is 10 to 20% in diabetic patients. The exercise for frozen shoulders are pendulum stretch, towel stretch, finger walk, cross body stretch, armpit stretch, and outward and inward rotation. Then, massage therapy and routine stretches can significantly improve your pain associated with the shoulder pain syndrome. This can reduce swelling, tenderness, not only in shoulder, but also in associated area. Then we go for the stretching and strengthening exercise for shoulder joint. Warm up your shoulder before performing the frozen shoulder exercise. The best way is to take a warm shower for 10 to 15 minutes. The exercise I mentioned, well stretch, the walk, cross body, arm stretch, outward rotation, and inward rotation. Then we go for the simple home advices that a physiotherapist can give it to the patient. That is getting the arm up while lying down, getting the arm up overhead while sitting down, getting the arm externally rotate while lying down, getting the arm to externally rotate while standing, getting arm up and back, getting arm across the body, wall climbing, catch something away, then sound limb forward and painful limb backward. The sound limb means the good one, that is the limb which is not affected with frozen shoulder. And these all are the small figures that denoting the exercise, that is home advices. And here I'm winding up my session. Once again, I thanking India members, Sir, Sanakan sir, and Jana ma'am for giving me this opportunity from my bottom of my heart, and also thanking Srisha ma'am, the faculty which helped me a lot in this venue, and our HOD sir Vijay Selvan sir, Vivian sir ma'am for helping me.
Hello.
And thank you. Hello. Hello, sir.
Yes, ma. You are not audible actually.
Okay. Hello. Is it out?
We will conclude it. No problem.
Okay. Then I'm stopping here this presentation.
Thank you so much, Ms. Sandra.
Thanking you, Chandra Mohan sir, ma'am, and Rubesh sir. Also, my faculties, Srisha ma'am, HOD sir, Vibin sir, and Safa ma'am for helping me.
Okay. Thank you,
Thank
Ms.
you.
Sandra. Even after having a lot of technical and internet glitches, you kept up the
Yes, sir.
spirit you presented again. I would like to thank HOD of KMCT College of Allied Health Sciences, Calicut, Dr. Vijay Selvan, for supporting his students to present their topics in ExRx India's for the students by the students. I would like to thank ExRx India team members. Thank you. Bye-bye.
Thank